Good evening and welcome this Tuesday evening on Nationwide 90 FM. It's Tuesday, August 29, 2023. My name is George Davis. This is your program on your favorite evening of the week. It's Prescription for Life here on the big station Nationwide 90 FM. Did I say my name is George Davis? Well, let me tell you again, my name is George Davis. And the man in the house with me, the expert on tap, is Dr. Andre McDonald. Good evening, Doc.
Good evening, George Davis, and good evening to all the listeners of Nationwide 90 FM. Especially today, George, the listeners that are in the western part of the country. And I say this because several persons would have engaged me this week physically, George, or last week, this week and last week. One man said he, did ask me to call his name. Came all the way from Westmoreland, and he came to see you, George. Came to see me from Westmoreland. There's another little old man, 70-year-old man, came all the way because he said, boy, he'd love to hear George Davis, and I want to tell his story tonight because he asked me to tell you hi and he asked me to tell you thanks. Old man, around 70 years old, George, and his family gave me permission to tell his story. Daughter brought him in because he has been seeking additional help, going to doctors, herbalists, all sorts of persons because he was losing weight. Lost, what his daughter said, was anywhere between 20 and 30 pounds, she believed, over the last 8 months to a year. True story. Gave me permission to use the story. And George, apart from weight loss, the gentleman had no other symptoms.
Yes.
Just weight loss. And he's trying to get help from east, west, north, and so on. The bottom line is, when I saw him, I examined him after looking at what you call a cachectic. That's a word in medicine. That means there's loss of muscle mass. When you look at the person, you can see when you look in their face and shoulders, you see very deep recesses to show that muscle mass has been lost significantly. So the doctor said to me, look at him, doc. He don't look like somebody who's losing weight. And I said, yes. I examined him. Not sure why, he would have had to wait so long. But there were these swellings. People call them wax and canal.
No, wax and cannon.
Wax and canal.
That's what Jamaicans call it, not canal, cannon.
Wax and kernel, or what we call in medicine, lymphadenopathy, lymph nodes.
Right.
There were swollen, enlarged lymph nodes, not only under his arms and on his legs, all over his body. All over his body, under his neck, chin, everywhere, And when I examined him, I said to myself, before I said to him and his daughter that, wow. I only could say wow because it showed that something was wrong. We did a number of blood tests on him. We did his complete blood count, liver, kidney function test, his prostate test, among others. And his normal white blood cell that should have been 4 to 11. And of course, we have more than 11 white blood cells. That is multiplied by 10 to the 9 to show you how many white blood cells you should have in
10 to
your
the 9th
body.
power?
10 to the 9th power. Normal is 4 to 11.
Right.
His was 256.
Wow.
Times 10 to the 9th power. The long and short of it is, it turned out that he had a cancer. And he was not aware of it.
Yes.
His daughter was not aware of it. And, we did ultrasound right there and then, among other things. And we found masses in his liver and other places.
Yeah.
So the cancer had spread.
Yeah. And it was the alarming weight loss that caused you to pry, to open the window and look.
Yeah. And this was cancer that was found quite late.
Yeah. Oh.
Yeah, because it has gotten to his liver. It's all over his abdomen. Oh. We never even gotten to CT yet. We did ultrasound and we saw it everywhere.
Yeah. My goodness. Well, Doc has had a running start to the program. I was about to tell you that the topic for discussion this evening is unintentional weight loss. And you heard Doc in that example, and he loves to give us real examples of patients he's seen. And the patients he sees informs his choice of topic. He says this gentleman, about 70 years old, was just dropping weight and had dropped a lot of weight in a year long span. They took him to check him out because there was nothing else wrong with him, only for cancer to turn up. Doc, you start at cancer. What else would well, all right. You say that he lost about what? 20 pounds?
Yes.
About 20
Yes.
pounds in about a year.
Yes.
Okay.
Yes. Yes.
What amount of weight has to be lost over what amount of time for someone to say, this is unintentional weight loss happening?
Excellent question to start, George, because that is the question. Or any journal that would talk about unintentional weight loss would start. And unintentional or involuntary weight loss is, of course, weight loss that is not forced or intentional. You never try to lose weight. You never expected to lose weight. Sometimes it is even unnoticed weight loss. And this is loss of greater than 5% of your body weight over a 6 to 12 month period. So if the normal 70 kilogram man or 154-pound man should have unintentional weight loss, he's going to be losing 7.7 pounds over a 6 month to 12 month or 1 year period. For the average person, when we look at average weights, we're talking about anywhere between 7 to 12 pounds. So for the average person's, George, the average man walking on the street, we're talking about anywhere between 5 and 7 to 12 pounds. So if you are losing anywhere between 5 and 7 to 12 pounds, depending on your weight,
Yes.
but we just worked it out in average, we have realized that once this happened over a 6 to 12 month period, it is important that you recognize it as unintentional if you did not intend it. And I'm going to tell you why this is important, George. Unintentional weight loss, significant findings of many major medical institutions and journals, often indicates a serious medical illness, often indicates a serious medical illness or a psychiatric illness. It is so important for persons to understand. And I'm going to give you a big figure starting up. 1 in every 3 persons with unintentional weight loss, when followed up over time, it turns out to be cancer.
33% of all unintentional weight loss cases
Yes.
lead to cancer.
Definitely. And that is why it is so important that having defined it and understand it, and it is unintentional, then we are in for something. The sad news is many patients with unintentional weight loss, George, tend to turn up to the doctor when the horse has gone through the gate. When I was preparing to do this topic, I looked back on a number of my patients who came to see me because of weight loss.
Yes.
George, 100% of them turned out to be something bad or serious. All once they saw it, especially when a family member, and this is why this program I'm appealing, because I sat and watched this gentleman who came in fun, talking about George Davis, came to look, thought his weight loss was just losing weight, even
Yes.
though his daughter was more concerned. He wasn't.
Yes.
He thought he was just losing weight, him not eating as much as him used to, and him say, man come from country.
Yes.
Him going out to him field and doing him work, and him don't see why him daughter fussing up himself. It turned out to be serious, and the daughter was devastated because she realized when I told her what this meant.
Yes.
And I'm saying to persons, to family members, you have your family member, you look at them, you see them losing weight, and the weight is just dropping, even though they're eating normally.
Yes.
and you don't see a reason for the weight to be dropping, it is unintentional. Find the doctor quickly.
Yes. Yes. Well, after the break, I want to ask you about the age profile because you say that unintentional weight loss, dropping 5 to 7 to 12 pounds over a one about 12-month period, is cause for serious concern. Is it for persons in any age band, or is there a particular age band most vulnerable? If you have a contribution to make, listeners, we are inviting that contribution. You can call us 618-8255. That's our digital line here in studio, 618-8255. Or of course, you can link us on 394-5433, 618-8255 or 394-5433. This is Prescription for Life. We're talking about unintentional weight loss. It's a window, into some serious problems. Back with us on Prescription for Life, we're talking about unintentional weight loss. You would have heard the doctor in the first segment, Dr. Andre McDonald, speak about the problems that can lead to unintentional weight loss. And when you check on the back end, why a person would have lost 5 to 12 pounds over a 12-month period, usually the cause is cancer. He says 1 in 3 persons who drop that amount of weight over that amount of time, there's usually a cancer diagnosis at the end. And he says that in his experience as a professional, all of the people who come to him who've experienced that kind of rapid weight loss, it leads back to some kind of cancer. So it's a serious thing, unintentional weight loss, and we are wading through the causes at this time. Doc, I did set up the question before the break about the age profile, the age range in which persons uh, should be particularly vigilant in because of the vulnerabilities of that age band. I wanted to know if there does exist a vulnerable age band, or rapid weight loss at any age band is a cause for concern.
Good question, George. Good question. The majority of people, if you live long enough, will experience unintentional weight loss, because the older you get, because age is a big risk factor. The older you get, the more likely you will get it. 15 to 20%, or 1 in 5 adults greater than 65 will have it. Very important for us to understand that. 1 in 10 of the general population tends to have it.
Right.
But 50% of persons, 1 in 2 in nursing homes, tend to have it. This is where we see.
Stick up in, Doc. Just before you go further, we have Rose online. If you get your headset going, Doc, and we're gonna go and talk to Rose. Good evening, Rose.
Hello, pleasant evening to you.
Yeah, man. Good to have you here. What's up?
Just calling with a comment and observations over the years.
Yeah, man. Go ahead, man. Doc, listening to you. Go ahead.
Weight loss.
Mm-hmm.
Besides cancer, you also have uncontrolled high blood sugar as well as thyroid problems.
It's a very good point to make. So we're going to be looking at some other causes in this Jamaican population. Diabetes and hyperthyroidism are 2 big causes. They come under a big group of causes that we call endocrinopathies. So in Jamaica, when you look when you go into our public hospitals, for example, and you look at the patients that present to our medical clinic, we have a big diabetic population. 1 in 5 persons in our population, and another 1 in 5 again would not know that they're diabetic. So 1 in 5 knows, and another 1 in 5 does not know. In other words, 2 in 5 persons in our population, we believe, is struggling with diabetes. Just know, though, Rose, that is type 1 diabetes more as opposed to type 2. Usually persons with severe uncontrolled type 2 can present with weight loss. However, it tends to occur more in type 1 diabetes. And when it comes to thyroid disease, it tends to be the hyperthyroid.
Yeah.
Males, George, and females are affected equally. And just want to say that for unintentional weight loss, there's a good point by Rose. There's an excellent point. when it comes to unintentional weight loss, George, a study was done, one in Israel and one in the United States. In Israel, they looked at 10,000 men, and they found out that for the 10,000 men followed up over the next 10 years, same thing in the US, they found out that unintentional weight loss is always associated with some sort of increased mortality. In other words, in Israel it was associated with 18% increased mortality. In the US it was associated with 24% from all causes. Not only cancer now, but there are many other causes that we will look at. The same studies show that 37% of the cases were due to cancer, 10 to 20% were due to gastrointestinal causes, 10 to 23% were due to psychiatric causes, and then there were the other causes like what Rose would talk about, the endocrinopathies,
Right.
the infections, etc.
But the 1 in 3 you spoke of in the first segment, you
Yes.
just said 37% based on the study. So
Based on this particular
oh, so
study.
it's near 1 in 4.
It is near 4 in 10.
Beg your pardon, 4 in 10.
Yes.
Right.
So it's almost the same, 37%.
Yes.
But these studies actually had a little higher results. That
Yeah.
They're saying that 37% of what they
Yes.
found. And what they
4 in
also
10.
said, when it came to certain type of cancers, for example, when they looked at gastrointestinal cancers, it was up to 40%.
Yes.
4 in 10. When they looked at lung cancer, it was up to 60%, 6 in 10.
Yes.
And when they looked at upper gastrointestinal cancers, which is cancers of the stomach, the upper gastrointestinal tract is above a particular area right at the duodenum there. Upper gastrointestinal cancer is up to 80%. So there are certain significant cancers that was even more. And in their studies, this is what they found. So it is so important to understand that once you meet the definition of unintentional weight loss, and it's so important because then people lose weight for different things.
Yes.
This is why when we come to evaluation, which you're going to come to in a short while, the listeners will know that as doctors, when a patient comes in front of you with rapid weight loss, you have to ensure that it is not intentional weight
Yes.
loss. 'Cause remember, people do all kind of things to lose
To
weight.
lose weight, right?
Once you rule that out and they had no intention of losing the weight, and you see now that it is unintentional, these figures are on the button.
All right. Anita is online. Good evening, Anita.
Hi, good evening, Doc. How are you?
I am fine, Anita. How are you?
I am not too good because I'm here listening to your program and I can relate to this topic.
Go ahead,
So
tell
my
us.
question is, Doc, can stress cause unintentional weight loss?
It definitely can. It definitely can. And I'm sure George is going to hit me on the other side of the program for the myriad of causes. But you're absolutely right. A lot of people can be worried. Now, stress comes under the psychiatric causes, George. Because remember, we said 10 to 23% is due to psychiatric causes. As a matter of fact, there's one particular very top journal that looked at this topic, and it started off by saying if you find a patient with unintentional weight loss, especially if the weight loss is either sudden, which means they were stable over a long period of time, and then all of a sudden it started happening, George, or it has been progressing steadily over a period of time. So it is going fast, but it is progressing, getting worse and worse and worse. They said that it is almost certain that it's either a psychiatric challenge of which stress can come under, or it is either a cancer.
Yeah. Any other point, Anita?
No, thank you, Doc.
You never tell me good evening, but it's all right.
I did say
No, you say good evening, Doc. I'm not charging you, I'm troubling you. Thank you for your contribution, Anita.
you're very welcome.
Good. So, Doc, well, let me given that Anita raised it, let me go right there. How does, well, it does appear obvious, but it could be different. How does a psychological issue that triggers a stressor, how does that translate into unintentional weight loss of the kind that we're talking about?
Yeah, so there are so many different kinds. So medically, they're going to say that in many psychiatric illnesses, certain hormones in the body are are turned on, and these hormones result in the body losing weight several times. But you have to understand that when it comes to psychiatry and psychiatric illnesses, there are many different
Right.
types.
But
You
it
would
has to
have,
do with more than an appetite suppressant.
yes, because I'm going to go there. There are persons who will look into the mirror. You would have heard about things like anorexia, nervosa, and bulimia, and all of these things. There are persons who, it doesn't matter how thin they are and how they look into the mirror and see a very fat picture. And then they will go and try to, one, starve themselves. Some people will eat and then induce vomiting, and these are significant conditions that as a doctor you have to ask about when the person presents to you. We see this more in females than males.
Yes.
When it comes to psychiatric challenges. Don't know if a female just called just to reiterate the point, but but we see a lot of psychiatric issues now. Another thing that is very important in psychiatry is there are medications that psychiatric patients can be on, and many of these antipsychotic meds, when they are withdrawn, can also result in weight loss. There's alcohol, George, which is a dependency type of medication. There's marijuana also. These things that patients are addicted to will cause weight loss, and they will continue to use them and to use them and to use them. Persons who are stressed or depressed, your caller would have spoken about it. Some of the times they choose to smoke. And we have realized that one of the big risk factors for unintentional weight loss is smoking.
Yeah.
You're smoking, you're not eating, and realize that these persons lose weight. Again, the pathophysiology, which is the big word for medicine to mean how this occurs in the body, sees many different names of many big hormones being activated. Some of them suppress the appetite, as you said, George.
Yes.
And some of them would cause an excess energy expenditure,
Yes.
so that the body loses weight.
I'm happy you clarified that, because the layman, the non medical expert, well, the person without medical information, medical training, would think that stress would serve to cause unintended weight loss by virtue of the fact that stress suppresses appetite. You don't eat, hence you lose weight. But you're saying it's far more complex than that.
Far more complex than that.
There you go. All right, let's take this break right now on the bell. I must tell you that our friends at Suretime Medical, they're responsible for us here on Prescription for Life. We can tell you that you can find them 10 Trafalgar Road in New Kingston. $3,500. That's the price for the start of a general doctor's visit. General doctor's visits start at $3,500, and it's 2023, so of course every self-respecting business accepts all major health cards, credit cards, and debit cards, and Suretime is a self-respecting entity, so they do accept all major health and credit cards. If you need ambulance coverage anywhere on the island, they will facilitate that. If you have an event that you need ambulance coverage just in case something happens, you want to be in a position to take care of that, they take care of that as well. And if you go to Suretime, you can spend the night depending on your condition. You don't have to go somewhere else to get a bed after you've left Suretime. They take care of all of that. If you want nutritional advice, they'll provide that with their experts there. And of course, they provide the best medical care in town and in country. All right, we take a break here on Prescription for Life. Back with more after these. We're talking unintentional weight loss and the problems that lurk behind the condition. Welcome back to Prescription for Life here on Nationwide 90 FM. Sometimes you may go to Suretime Medical, 10 Trafalgar Road in New Kingston, and your favorite doctor isn't there, and you're wondering, where my doctor gone? It could be that he or she is with a team making a house call, because they do those as well, a Suretime Medical. So if you have a family member that is frail and at home and needs emergency care, just make that call to Suretime Medical and they'll dispatch a team in short order. They'll dispatch a team with dispatch, yes, to take care of those needs. Remember that as well. Our good friends at Suretime Medical, we thank them so much for their support. You can find them landline, you can call them 906-7873, or you can call them on 394-5433. All right, so here we are, Doc, halfway into the show. Unintentional weight loss. We've gone in depth in cancer with cancer. Two of our callers, Rose and Anita, raised different issues. Anita spoke about stress, and Rose spoke about the endocrinopathies. No, you know what? You know, go again.
The endocrinopathies, things like diabetes.
Yeah, I was about to
and
say encephalopathy, which is a part of bovine spongiform encephalopathy, which is BAC, the mad cow disease. Not when it's a fool, you know. All right, there we go.
Okay.
All right. So, all right. I did. I took a list of causes because I knew that my listeners, our listeners, would be keen on the cause of unexplained weight loss.
Yes.
So you spoke about hypothyroidism.
Hyper.
You mentioned hyperthyroidism.
Yes.
I've seen something in the literature that says a condition called Crohn's disease can contribute to unexplained weight loss. And I wanted to give us a little bit on that.
Good. The thing is, even though we know malignant, there are several cancers of the gastrointestinal tract that would come under the malignancy or cancer causing causes
Yes.
of unintentional weight loss. There is what you call now non-malignant or benign, which means it's not cancerous,
Yes.
gastrointestinal causes, of which inflammatory bowel disease is one such. I remember when I was a medical student, third year medical school, and I was at Kingston Public Hospital, and we saw a patient who had lost significant weight.
In Magadong.
Definitely, George. And one of the things about him, when you would go on the ward, he would vomit, he would vomit, he would vomit. That was and he's always complaining about stomach pain.
Stick up in. At the time, did they know what was wrong with the patient?
And they had an idea.
Yeah, okay.
They had an idea. Remember the consultant telling us that this is what he thought the patient had. He was absolutely right. They took him, they did an endoscopy, they found an ulcer in his stomach. He had chronic peptic ulcer disease. He also had some other symptoms, and a big clue was that his stool was dark.
Yes.
And we know that stool is dark. Nationwide listeners know that stool is dark because when blood comes from the stomach and the hydrochloric acid acts on it for more than 4 hours, it turns it into dark or black looking blood.
Yes.
And it mixes now with stool from very high up in the gastrointestinal tract. By the time it gets out of the anus, it is what you call melena stool, black stool. That is hydrochloric acid, on the action of hydrochloric acid on the hemoglobin, which is that iron thing in blood.
Yes.
Now, that is what we saw with that patient. And we knew that he had a bleeding ulcer, and this is why they took him to the minor ops. They did a endoscopy, and they saw that he had a bleeding ulcer. That non-benign, non-cancerous gastrointestinal tract condition, this one is of the upper gastrointestinal tract, is again a serious condition, and you have to sort it out because a bleeding ulcer can be something that has led to person's demise if it is not treated.
Yes.
And 1% of all stomach ulcers become cancerous also.
Yes.
So you have to be very, very careful with that. Malabsorption syndrome, and there are a couple. There's this common one called celiac disease. Is
Yes.
one where
That's on my list.
yes, there is inability of the body to absorb the stuff that is passed through your mouth to go down into your stomach to be eventually absorbed across the small intestine.
Yes.
So it comes back out. It means you're not getting the food. The food is not being absorbed to go into your body to break down into sugar to make you put on weight.
Yes.
So you're going to lose weight. Inflammatory bowel disease is divided into usually what we call Crohn's disease 1
Yes.
or ulcerative colitis 2. Crohn's disease tend to affect the lower part of the intestines, while ulcerative colitis can affect anywhere from the mouth to the anus.
Yes.
Ulcerative colitis tend to bleed more. Crohn's disease tends to come with abdominal pain. It is when you look at these, as we call them, non-cancerous lesions, the patients will come in and they will present with abdominal pains. They'll present with nausea. They'll present with vomiting. They'll present with diarrhea. They'll present with weight loss. And remember, our listener earlier spoke about stress.
Yes.
IBS, a big cause of IBS is stress.
Yes.
Persons who are under significant stress, and they will give you that history that they had some significant stressful event, and when they're stressed, them get abdominal pain and diarrhea.
You know, one of the funny things about doing science in high school is that you would answer certain questions and you try to reason out the answer. And you think that you've given a good answer. Then when you get the test paper, you realize, and the teacher mark up beside it, you realize, oh my God, this answer was so ridiculous. And I say that to say that in medicine, there are so many things that seem obvious and logical, which aren't. They always have a deeper meaning. So you remember I said to you that people would think that if you're stressed because you're not eating, that equals unintentional weight loss,
Right.
blah, blah, blah. You're saying it's far more complicated than
Exactly.
that. There's one of the causes I'm seeing here that says, dental issues could cause unintentional weight loss. Now, obviously, you're writing an answer to that question. You say, oh, clearly, then something wrong with your teeth, you don't eat as much, unintentional weight loss, that is it. And you're going to tell me that, no, it's far more serious than that.
Well, there's a number of reasons. One of them, George, is that you don't eat, but another is that you don't eat what you should eat when it comes to nutritious foods. The elderly tends to have a problem with this more than the average aged individual, and that is dentition goes with age, and if the correct dentures or replacements are not put in, and this is why you see that in the aged and in the institutionalized, remember it's 50%, 1 to 2 in nursing homes for unintentional weight loss, where they are not adequately provided, many of them simply because of a social situation, just like cost, with the correct eating utensils, including teeth. And if they're not fed constantly properly, if somebody is not there who is willing to feed them and take their time, then they do not eat. And this happens because in order to eat certain types of food, George, you need teeth. To eat them, to chew them, to break them apart. Digestion starts in the mouth, and digestion just simply means breaking down of food. And teeth is very crucial. Take all your teeth out of your mouth and see how digestion works.
Can't even eat jackfruit, doc. All right. The issue of, help me with this one. Is it? I would say it's dysphagia, but I can imagine it's not dysphagia. Dysphagia, swallowing problems.
Dysphagia is fine. I was in the US though, and I heard a doctor very recently call it dysphagia. So you're not.
The US is no example.
As a matter of fact, George, I was a little stunned because I was wondering what was he talking about, because I never heard. And other doctors who would have learned medicine in my part of the world would wonder, and I said, dysphagia, what is dysphagia? I said,
tackle that one first, and then we'll go to risk factors.
Dysphagia is difficulty swallowing. And that happens because of many different challenges. It happens because some of the times because of cancerous lesions. It happens some of the times because of non-cancerous lesions, which can take place in the upper upper gastrointestinal region, particularly the esophagus, towards the top of it, towards the back of the throat, as we would know it. And there are several reasons why that can happen. The bottom line is that if there's disease of it, then people have difficulty swallowing. Usually when somebody presents with dysphagia and you look at the esophagus, the causes are usually divided into something that can happen from outside, something in the wall of the esophagus,
Yes.
or something inside. And the sad thing is that in my experience up to recently, when I had somebody with dysphagia, again, that it was an older person.
Yes.
Again, when we did the necessary investigation, had to do CT among other things, it turned out to be a cancer. You really don't like dysphagia. Some of the times you not only have dysphagia for solid foods, but sometimes dysphagia just for liquids alone, and it can help you to divide up the causes. Never usually a nice thing.
As we draw closer to the break, we could go to a section called risk factors, but you've spoken about smoking and the effect of that. You've spoken about eating disorders. You've spoken about poverty, especially for those who are infirmed in the nursing homes, and not so much allergies, but we'll get to that. But the thing is this: if it is that unintentional weight loss is such a big problem, is there also something to worry about where fluctuating weight loss is concerned? So in a 12-month period, you lose 20 pounds. Then you go doctor and they run some tests, can't find anything, didn't see anything about cancer. Then you go back next year and you put on back the 20 pounds plus 5. Then you go after that and you drop 20 again. Is that which is the worst situation to be in? Unintentional weight loss or fluctuating weight loss, especially after age 65?
Well, that's a very good question. And at the start, we did say quickly, if you have progressive weight loss. So if your weight is stable, George, it means that you're running 80 pounds for 3-4 years, and then all of a sudden you drop 20 pounds over the next 6 months. That's worrisome. If it is that your weight now, you suddenly, even if it is not stable, but you just suddenly start going downhill, that's worrisome. Fluctuating weight loss, taking it off, putting it on, taking it off, putting it on. We see a lot of that in persons who are on certain types of diets, or they're trying to lose weight, or they're exercising, or so the fluctuating, the other type is worse than the fluctuating.
The alarm bells aren't the same.
Definitely.
All right. On the point of allergies, how do allergies contribute to unintentional weight loss? That sharp drop in weight.
Yeah, but several different things. So it depends now. If it is that you are allergic to, so several people will have what you call atopic condition. Some people are born, George, don't want to say unfortunately so, but they are born more allergic to some things than others.
Yes.
Others will go for years and not be allergic to anything.
Yes.
And then all of a sudden, I see you want to take your break,
Is that
George.
me and MSG?
Yeah.
I could eat Chinese food with the MSG when I was a boy up to my mother is Chinese.
Yes.
So you can imagine me can't eat Chinese food now, doc. Because I can't. If I eat MSG now, I'll have to go to some medical facility pronto or else.
Therefore, and I want to tell you something about that allergy and diarrhea, and also when you come back from your break.
All right, it's 8:45 on the clock. Let's take the break and come right back. Last segment of this discussion on unintentional weight loss on Prescription for Life, brought to you by Suretime Medical, 10 Trafalgar Road in New Kingston, 906-7873-3945-433. House calls, overnight visits, island-wide ambulance coverage, the best medical care in town and the country and midtown. Suretime, they are your people. Back with us on Prescription for Life here on Nationwide 90 FM. It's back to school, it's back to school. And for the back to school period, at Short Time Medical, and for the month of September as well, because September is the first month back. You can take your child or ward to Short Time Medical, and for a fee of only $2,500, they'll get a medical done for you. They'll do a nice medical and give you a nice profile of the things that are right or not so right with your child or ward between now and the month of September, the end of the month of September. $2,500 for that children's medical at Short Time Medical, 10 Trafalgar Road in New Kingston. So, all right, Doc, unintentional weight loss. We are in the dying embers of the program, and
And you were just asking me about the allergy, George.
yes,
I'll
the
just
allergy. Finish it
that
up.
quickly.
Yes,
So I'm saying there are some people that are born with allergic conditions. It's in their family.
Yes.
And when you check different family members, they'll be allergic to different things. There are some persons, George, that will just get allergy to certain specific things, and we're talking about babies, for example, children, for example. There are some people who can't eat certain things because they're intolerant to it, and so they can have diarrhea, right? Food allergies,
Yes.
and so every time you eat this sort of thing, you pass it out.
Yes.
It's almost like a malabsorption syndrome, and of course, for the same reason, you're going to lose weight.
yes. There you go. All right. So I've been wanting to ask this question all night, but if a person over 70 goes to a doctor, and based on the results of the last 8 months, 8 to 10 months, they can say, Doc, I've lost 25 pounds. Is there a real imperative on the part of the doctor to want the person to put back on that 25 pounds? Let's start there.
The imperative. That's an excellent question, George. That's not the doctor's role at all. The doctor's role, George, you see, when somebody comes and by definition they have greater than 5% of their usual weight loss, the onus is on the doctor to find out what this person's usual weight is. Because when you have somebody approaching you with what is unintentional weight loss, you want to document that weight loss firstly. Why? Because 50% of the persons who will tell you that they lose weight actually don't lose weight. Some of them even gain weight. So people will subjectively believe that they have lost weight, but it's not necessarily true. And if they weren't your patient before, like your friend who came all the way from the country to
Yes.
see me, that I was seeing for the first time,
Yes.
his daughter was able to say that, look here, this is the weight he normally is. And when she said this is the weight he normally is, and the nurse put him on the scale, and he was 27 pounds less than the weight he normally is, you had at least some form of comparison. So the first thing you want to do is to document it so that it does not fall in that unreliable category.
Yes.
And next thing you call it weight loss when it is not. If you have documented it, you ask some perfect questions today, George, right on the money, because this is how it is done in medicine. You have to evaluate the pattern or the duration. That is what you were asking me about in terms of fluctuation
Right.
versus progressive
Yes.
and sudden.
Yes.
Once you document the pattern and you see that this is either progressive or it is sudden, it now sends off some alarm bell in your head as the doctor. Very important, because 1 in every 5 persons with a greater than 10% weight loss, 10% for the average person is about 15 to 20 pounds, which you just asked about,
Yes.
usually have either heart disease, lung disease, or cancer.
Yes.
And this is what one significant study showed. And this is why, after documentation, finding out the pattern is very, very, very important. You have to be on the money with that one. The third thing you have to do is to ensure that this person in front of you does not have an eating disorder. In other words, it's not them trying to be anorexic or bulimic or losing weight, or they are intentionally doing it.
Yes.
It's a big thing to ensure. And fourthly, you have to ensure that the questions you asked earlier, that they don't have a malabsorption syndrome,
Yes.
that they're not losing because of that sort of GI challenge.
Yes.
After you
GI
have,
for gastrointestinal.
there you
There you
go.
go.
And after you have done that and you physically examine the patient and you say to yourself, this is a patient who is losing muscle, no fat is being lost. You look at head and neck, general appearance all down. They look like they have lost weight. You have to do a big general medical examination, meaning you're examining heart, lung, kidney, abdomen, looking for any masses, doing neurological exam, looking at their cognitive function, how they think, examining them like my patient, looking for things like lymphadenopathy.
Yes.
So you want to see, any lymph nodes. You want to see, am I looking at, because remember, cancer is a big thing in these
Yes.
patients. So you have to look, you have to do a proper physical examination. Big history,
Yes.
I just spoke about, good physical examination. And you always have to be bearing in mind, George, that what are the possible causes of this person for this particular age? Always, it is not critical. What I did with this gentleman, what the most medical doctors definitely would do in Jamaica is that if after all of this an apparent cause is not staring you in the face. And even if, like when I examined my patient, I saw the lymphadenopathy, because when you examine somebody and they have all these swellings all over their body, the diagnosis is telling, George.
Yes.
It's staring you in your face.
Yes.
You still would have to do the complete blood count, the kidney and the liver function test, the thyroid function test. Remember our friend who called earlier, brilliant. She spoke about hyperthyroidism.
Yes, Rose.
And she spoke about diabetes.
Yes.
So you have to do your glucose profiles, your thyroid function test. You have to look at your stool, HIV, hepatitis, chest x-ray. You have to look at all of these things still to ensure you don't miss anything. The sad thing for the patient, I did, when I did all of these studies I just told you about, almost every single one of them were abnormal.
Yes.
I don't think we found one normal thing.
Yes.
And so you have to do these things so that you can properly evaluate the patient. That is the role of the doctor.
Yeah.
The doctor must have a high index of suspicion. The doctors will tell you, as I have seen over the years, that when persons rush to you having lost 15 to 20 pounds in a 6-month period, George, by definition greater than 5% in 6 to 12 months, 15 to 20 pounds is a whole heap of weight. That's not usually a walk in the park.
Hear you on that. So usually you would say talk about diet and smoking and everything, but this one is so serious that if you experience this kind of alarming drop in weight, see the doctor, and the management of the situation will only proceed after those examinations are finished.
I'm sure my patient, you can't call his name, but he did give me the permission to use his story.
Yes.
He would be advised. He told me that he would have gone to a couple of herbalists.
Yes.
So he would have visited some herbal doctors. He would have been given advice by the doctors. He would have been given a couple of herbs.
Yes.
Which, by the way, George, can cause you to lose weight.
Yes.
And there was one time when a member of his family believed that it was the herbs he was getting from a particular herbal doctor that was causing the weight loss. And that is why they said they never really worried too much, because he was being detoxified.
Oh.
That's the word that
Yes.
was used. And therefore he was passing out the stuff, and it was said to be the bad stuff that was coming out of him. So he was shedding the weight. Many of these herbal remedies, along with other medicines, medication, pharmaceutical meds, can cause weight loss. This is not one where you stay at home and try to diet, exercise, do your own thing.
Yes, which is why I said what I
Google
said.
your
Yeah.
own
No, it's
remedy.
different.
No, this is one that is different, and this is why I started the way I did.
Yes.
And this is why I'm going to end the way I'm ending, to say to the listeners that in my experience, and having worked now for 21, we're in June, 22 years.
Yes.
As a medical doctor, started in 2002. I don't remember seeing somebody, even as a medical student with our patient with peptic ulcer disease, I don't remember seeing somebody with rapid unintentional weight loss that did not have a significant medical challenge that needed rectifying. It is not something to joke about. It is something to get to your doctor and get there fast.
Whoa, what a life we live. Excessive weight in older age, problematic. Rapid weight loss, problematic. Yeah? Ah boy, anyway you go Makajukyo is what the proverb says. Alright, let me tell you as we wind up the program this evening that general doctor's visits at Short Time Medical, they start at $3,500. Short Time facilitates night care, they facilitate house calls, they provide an ambulance service that is island wide in reach, and they are offering a back to school medical special for $2,500. You see the doctor for that. Take your child or ward along and get them checked out ahead of the new school year. It's very important that you have a profile of the things that are right and wrong with your child before September morning comes. So go on down to Short Time Medical, 10 Trafalgar Road in New Kingston, and get those medical checks done. I must also tell you that being that the new month starts on Friday, the new school year starts on Friday, we are going to have a couple back to school themes to discuss in the month ahead in Short Time Medical, in Prescription for Life, beg your pardon, brought to you by Short Time Medical because of the importance of dealing with things that may be affecting children. There, so funny. I was having a conversation about this the other night, Doc, and we were saying that so many children who otherwise would have done well in school, but they couldn't see very well, and nobody thought of getting them glasses, or they had a hearing problem or whatever, and we write them off and say them dunce. Yeah.
The listeners would be amazed of the stories that will hit them next week.
There you go. All right, that's it for us. I want to thank our producer, Latoya Lawrence, who's proceeding on some well-earned vacation in a few days from now, and Michelle Dean, China Girl, who's here with us, supporting the Prescription for Life team. Andrew Anderson is the man behind the controls. My name is George Davis on behalf of Dr. Andre McDonald. Good evening.